this particular session. And then if you can, make sure that if you're not presenting, to mute your audio so that we can get through the meeting. And then please hold the questions till the end. I'll go through, and just when we're about to end, we'll set out a poll like we normally do for these particular meetings. And then once we're about to the end, we'll open up for questions. So again, please make sure that you're on mute and hold your questions till the end. And then I'll also show you a glimpse of what we're going to be up to in the next few meetings. So let's get started. Let's see if we've got, if I've got it on the wrong slide. This is the first one?
That's fine. We can begin there.
Sounds good.
So thanks for asking. Appreciate the opportunity to have a chat with you. I hope there's some background noise here. I hope it's not bothering. What I tried to do with this was just kind of walk through an evening for Lodge, if you will. And I think the first step, and we'll talk about each of these slides, but the first step was your personal health, and should you just plain stay home. A little bit about entry to the Lodge, meeting site and Lodge prep, meeting prep. So there's two different things there, the site and then the prep for the equipment and so on. Degree prep, and then post-meeting, and then other. So we go on to the next slide. I'm going to talk a little bit about the personal health. And these are things that you know. But if you have been exposed, quarantine, 14 days, 10 days, it depends on who you talk to. We're learning more and more, but we'll still say 14 days. The bottom on this slide, it says, do not contact or spread COVID, and you don't want to do that to your brothers or anyone else if you can avoid it. You've all got thermometers. If the temp's above 100.4, you stay home. The temperature, the next slide will show, just hey, don't go there yet, but the next slide will kind of show you where I'm at on this. And remember that the symptoms, there's a lot. Diarrhea was a symptom, shortness of breath, cough. Loss of smell seems to be an early on change, and then changes in taste. Remember that you can't taste if you can't smell. So smell makes taste pretty much what it is. Runny nose, myalgias is muscle aches and pains. Headaches, you understand. Fatigue, I think you understand. Anything else that's new? Stay home, possible self-quarantine 14 days, and just wait and make sure that you're well. The reason this is important is this disease sheds for 3 days before you get sick. 3 days, and that's the problem that you're seeing us all face right now. We don't know who's got it, and before we figure it out, it can be spread around a bit. So the other piece that we don't know about is the next comment, is we don't know about the infectivity or immunity either after COVID. We don't know if you remain infective, thinking not, and we suspect that there's immunity, that you're not going to get it again. And the latest number I saw was maybe up to 3 months, but we really don't know. This is a kind of illness that's driving my medical students crazy, the residents, all of us, because it's new. We don't know anything about it and can only surmise based on previous RNA viruses, SARS, MERS, and so on. Next slide. I kind of like the next slide. It's a CDC slide. And if you'll notice on the top line, fever and chills, this is why fever is important. Strep throat and other things will cause fever, but COVID does. And when you're getting down, there's only a couple other things that get in there, and flu and COVID kind of run together. But you'll notice the mix of all of the other symptoms through this checkoff. And generally, as you understand medicine, and as I understand medicine, our job is to take a group of symptoms and a group of findings and come up with diagnoses. A lot of times we don't have tests and so on to make the diagnoses, and we have to do the best we can. So all of these things are factors, and you pretty much know what they are. Next slide. So a lot of discussion, but what we really don't want to do is spread things around. So before going into the Lodge, we're hoping that we've got disinfectants, the touchless types or whatever, set up around. And actually the isopropyl and ethyl alcohol disinfectants are better for this disease than soap and water, although you'll see different arguments about that. They both work, but certainly disinfectant, I've always felt that soap and water is the answer, but disinfectant works very well on this. Temp checks, it's up to the lodge and your lodge leadership. Are you going to have a temperature checker at the door? And I don't think there's anything wrong with that. And at the same time, you can have a checklist with some of the symptoms that I just put out on the last page. Usually what we're after is recent upper respiratory infections, loss of smell, cough, and those type of fevers and so on. But the lodge, you could argue, I think that this could be done before a person comes to lodge, so you wouldn't have to worry about it. But for peace of mind, it's probably wise to have a temperature gun and just go ahead and use it. They work really very well. And just check people off as they come in. Put on the mask before entering. If you have a medical exemption, then you should wear a face guard or shield, because our goal is not to infect a brother or to get infected ourselves. And the reason for the masks and for the face guards and so on is to protect both ways on that. The namaste is the Hindu, the folding of the hands type of greeting. That one, you're not touching anyone. You can bump elbows and so on. We're kind of pushing back on handshaking. Social distancing is important. I put temperature in again just to remind us about the temperature. The sign-in or roll call, we want sign-ins. As a physician and as a public health official, I would like the sign-in list, because if somebody is ill, we need contacts. One is there's somebody there that had it, and secondly, to tell the people that were there that they were exposed and that they should probably quarantine and watch. And then the final one is keep your hands away from your face. You know, it's interesting. I wear goggles and a mask when I'm practicing, and I'm always trying to lick my thumb to turn the page. And you just, the mask, if it does nothing else, it gets your hands away from your face and away from your eyes. The same with the goggles. Face guards are really nice because then you don't necessarily have to wear a mask with a face guard, and you're protected both ways with that. So we know that the use of a face mask knocks your oxygen down, 3, 4, 5 points, whatever. And it does make you a little more short of breath, and that can certainly be measured. So someone with bad lungs, they may not be able to use a mask. Suggest that they talk to their physician and get a statement so that they're safe when they go into stores and so on without a mask too. And again, the face guard is great, and they're not that expensive. And I think somebody said Costco last night. Somebody told me Costco's got everything. So next slide. Now, the meeting site should be prepped, and somebody in the lodge, leadership or staff or whoever, poor secretary can't do everything, but the room should be set up so that you've got your social distancing. Also, the room should be empty for 2 days between use and ventilate the best you can. The argument is how long. Some are saying 4 days. Frankly, it looks like the virus doesn't do well in air, but we don't know. And certainly what's important is the size of the droplets and all the rest. But generally, after a couple of days, the room is probably pretty good. How long does it last on various surfaces? We're not completely sure on that either. Lysol is a great way of cleaning, and it's a good way of just checking things out and making sure the room is good. And that should be done after you get done with it and the next person before they use it. Bathrooms, we've argued back and forth. I think 1 or 2 in there at a time is probably enough. And again, what happens in small rooms, think of us in our examining rooms in the clinic. I was just looking at, for medical students, and one of the places had written in, well, we have a scribe, we have a doctor. If we put a medical student and then they bring in a couple of people, we can't have them all in there. So the medical student's going to be the first to go because we don't want to have too many in the room. 15 minutes, if you've got a spreader in there and you've got a tight room, people are going to get it. One of the things that's important to remember is, and it's nice, is that most of our lodge rooms are big with high ceilings and there's a lot of cubic space in there. But again, you want that room ventilated well. It's nice to open the doors, windows, and if the window is such that you can put the fan so it can blow out, I think that's a better way than blowing in. But otherwise, if you stand it in the door, it's going to blow in or circle it around either way. But it's best to try to ventilate the room as much as you can. Discussion last night about roof vents also and other ways of doing it, and a discussion of having a 40% fresh air turnover as the minimum. But again, small spaces, we found that about 15 minutes will spread the disease. The medical school is using no more than 10 minutes in a small room. That begs us to look at elevators. Most of our elevators are such that you're not going to have that much time. I think in Duluth, what we've decided on the elevator, Dennis and I, my secretary, for that building is we're going to say 2 in the elevator at a time and just try to keep the risk down. And again, the room to be disinfected before and after use. Next slide. So again, the room is set up for social distancing, follow that. Disinfectants are available on the way in and out. Equipment is disinfected before and after use. Gloves available if needed. Plus minus, it's not going to hurt to wear gloves. Just remember that they need to be taken care of also. Certainly you can disinfect your hands and so on. Face shields or guards, especially in high risk situations. So we consider high risk when we're seeing patients face to face, and that's level, what we're calling level 4. And in those situations, mask plus eye protection. So you could use a face guard and goggles, one or the other. And in a situation where if I was master, I might be tempted to just use a face guard so people could see my mouth, or use a face guard and a mask. And degree work, the best would be a face guard plus a mask. The best face covering is the one that you're going to wear. So that's, you already been through this. And in the buildings, what we're requiring in Duluth is that everybody will be in a face guard and a mask, one or the other. Both is okay too. And again, the beg to record attendance because we may need it for tracing. Next slide. So little masonry, know your work. You know, if you know your work, you're going to get it done. You're going to move along. You should have it memorized. You should be able to practice. You should have practiced. It should be succinct and concise. Past Grandmaster, I can throw that at you into the past master, but I think it's really important. And the next one is walk through your degrees. And this is a Tony Kroll comment. I hadn't thought about this, but going through the degrees and making sure that the degree is touchless. And you can sit back and think these degrees through and figure out ways of doing it in a touchless way. Talk to your custodians and so on, just to make sure that that works. Again, I talked about the master. Now, if he's standing up in front, when he's talking, the aerosol from his voice is 20 feet. The 6-foot thing came off the airlines and seats. 6 feet is too close. Actually, it's closer to 10. And the droplets can go a fairly long distance, and the aerosol may hang in the room. And that's why the two-day turnover. We've argued a lot about food. Well, we haven't argued about food. It's a no. We've talked about water and a drink and so on. We had some discussion on that again last night. You can put the water in the car and go out and get it if you need it. But we've decided it's still best to keep food and drink outside of the lodge. And that may change as we have further meetings. Robes, if appropriate, they should be worn. In my comment, I don't think they need to be, the robes need to be washed, but I would say 4 days between use so that they are aired out and that the virus, if there is any on it, has died and it's not there. And I like scrubs. You need something that's washable and easy. I don't think you need a coat and tie to do degree work always. I was always told you do it in your work clothes. It's work. But at any rate, something like scrubs or something that you can take home and wash is a good thing. And I would do that after you get done. Next slide. So afterwards, dispose of the disposables in an appropriate fashion, disinfect the room, air the room out as best you can. One of the things that we did, I threw the social distancing thing in the lobby. There's a tendency for everybody to congregate in the lobby, especially in a Duluth building. And we're blocking that off so that there's walkways through. The lobby is going to be roped off. The out front area, the cloaking area, and the cloak, the robing area and the cloaking area, and the lobby basically roped off. We're going to ask attendees to stay in their assigned rooms. And again, no food or drink. And if you're in that assigned room, you'd stay there, and that's where any congregation would take place. General feeling is move it along, and early on now, until we get things going and we know where we are and we know more, I would try to get out as soon as you could. Remember COVID skills. If you move to another venue in the building, and sometimes that probably will happen, then you must go through, in my mind, it's the same as when I go from the clinic to the hospital, I get rescreened, and I have to sign in again. And I think that's probably an important thing to do. Next slide. I think that's it. Oh, others, tips, yeah. Again, we talked about the importance of small rooms. You get too many people in a small room and the risk of infection goes way up. 15 minutes approximate time. We're saying 10 at the med school is all we're going to allow. Disinfect hands. You do that a lot. If you wear gloves, you disinfect before you put them on, wear them, disinfect the gloves if they're vinyl or rubber, and then disinfect your hands when you get done. It's just like being in surgery almost. Protect your eyes, nose, mouth, masks, face guards. Do not touch your face. Learn to not touch your face. Just an aside, one of the things back with SARS and MERS, we had to teach the Chinese not to spit all the time. Spitting is bad. And please, as you go outside and so on, probably try not to do that. The ventilation of the room is very important. And the MASTI is probably the best way to greet each other. So with that, I would ask if there's any questions. I took you through a kind of a whirlwind of a lot of material. At this point, we're getting a better feel of this illness. There is a question if we're already seeing some mutations. I've read some articles where we're looking at maybe there's 4 or 5 mutations, and I don't know. I don't know if we know for sure. We do not know what this is going to be like coming back. Our concern right now is with the mobilization of society and the closeness of society. We're seeing increasing numbers, yet with the younger people, we're seeing less infections. The concern, the big concern, is the long-term effect of this illness if you get it. We do not know. We do know that it affects the heart, the kidney, the lungs, the brain, the nervous system. We know that that's there, and you know it's the nervous system because it knocks out smell. And smell is, there's just a little cribriform palate in the top of the nose. It's right next to the brain and right straight in. And if you're knocking smell out, you're affecting the nervous structure. So you know that that happens. So it's a disease that I don't think you want to get. When are we going to have an immunization? Maybe after the first of the year is what Fauci says, and I tend to agree with him. Russia has now turned out an immunization, and what they're basically doing over there is they've had the early trials, the 40 to 30, 40 people to see if it kills them, and then after that, a little larger one to see what happens. And then they're doing their major trial, just giving it. And generally what you like to do before you do that is have a further study it with big numbers, several thousand people, before you turn it loose on a population. The immunization is going to be the thing that'll get us back to normal life when that's available, and once we get decent herd immunity. So I'll shut up. And thank you.
Thank you, most worshipful brother, for that presentation. At this point, I'm going to go ahead and release the poll and open it up for questioning. So
there's a couple questions that came up to me directly, instead of on the group chat here. Drinking, is it worthwhile to wear latex gloves at the meeting? And what could be a problem is if someone uses a drinking fountain at the lodge?
The drinking fountains went out a long time ago, and I think that our clinic, the drinking fountains are out. Some places still have them, but it's an area where drinking, spitting, and all the other things, you're close to someone else's, where somebody else has leaned over and so on. I think if we're going to do water, it would be better off to have a individually labeled plastic container. And what was the other part of that question? I already forgot. I'm getting old.
gloves, are
Oh,
they?
gloves, yeah. So if you're working the COVID unit, before you go in, you're going to have to, there's donning and doffing. Donning is putting it on, doffing is taking it off. And the thing that's really, really important for healthcare workers is to make sure you put it on correctly and you wear it correctly and take it off correctly so you don't infect yourself. So with gloves, what's going to happen is you have to wash your hands. That's first, just talking the gloves. And then you put the gloves on. And then in between each one or with the use of the gloves, you got to wash them each time. And then you've got to wash your hands and so on when you take them off. Quite frankly, I'm not convinced I don't use gloves in practice. I just use disinfectant. If I was on a COVID unit, I would probably wear gloves along with the gown and everything else. There's no place where things can get in. As we've talked about this in the past too, I think cloth gloves, you say you're doing a degree or something, could you use cloth gloves? Again, then you're going to need to wash them after you use them and so on. But right now, I'm not convinced that gloves are really that essential, personally, in our lodge work. But you can wear them, and I think what I would do probably is disinfect before and after.
And then one other question from Joel Friedman. Have the custodians come to any conclusions yet regarding putting on degree work, especially in regards to guiding the candidate in I can't pronounce that word.
Circumambulation.
Yes, thank you.
We haven't talked about that, and that's something they need to talk about. In this situation, I would personally, if I was going to be doing it, I would probably have a mask and either goggles or a face guard on because you're close to each other, and there's going to be a lot of talking to each other and all of that. So I would gown up and face protect and so on. And you can wear gloves. So there's nothing wrong with gloves at this point, and then take them off afterwards. Just remember to wash your hands or disinfect your hands frequently. But the custodians haven't gotten to that point. And in my discussions a little bit with Tony Kroll, as we look at things, there's a lot of places where you can do that probably in a touchless way and just walk side by side, and you could even social distance if you needed to.
If you don't mind my interrupting, am I on?
Yep.
Yes.
You're on.
Okay. The custodians have met, and that's what that last edict was, that the only thing that we're allowing is a presentational type of first degree, and we're only doing first degrees. And essentially, it's mask and gloves and face shields for 3 people, the master, the candidate, and the senior deacon. And actually, the candidate is a member of the cast. And we did that because he can dress himself. And we don't have to have people in the preparation room. So all we do is go out there, get him, and bring him in. And that way he doesn't have to take off his mask when he's talking about kissing the Bible or any of the rest of the stuff.
And the preparation rooms are small, and it's better to have fewer people in them.
Correct. And that was our rationale for doing it that way. And right now we're saying we will come show you how we want it done. And then if everybody's in agreement with that, then we will allow the lodges to do them. But at this point, it is only presentational as approved by the Board of Custodians.
How is the candidate prepared then?
The candidates are sitting like they are in a one-day. They're sitting off to the side. The candidate for the degree is a master mason. So he's going to go prepare himself. He doesn't have to worry about it because he's part of the degree team.
He's going to be guided, masked around the altar without shirt and barefoot.
You're talking first degree, but yeah, the answer is yes.
Okay.
We had talked about that and asked, among the doctors, because we send a thing out, and they said that should not be a problem if they are dressed as candidates.
And again, everybody's been pre-screened.
Correct.
One of the things I'm concerned about with medical students is if I'm going to send them out to a rural site, the rural site may say that you need to be quarantined 14 days before you come here. And part of the professionalism that's going to have to be hammered into the students is that that's the way it's going to be. And that means that while you're here and while we're involved in the education piece, that you need to keep yourself in a situation where this is not a problem. So I would hope that if you're doing a degree, that the person that's going to be the candidate has done all of those things. And that really cuts it down so that the risk is pretty low. Probably less than the food store.
Any other questions come in? I'm going to go ahead and end the. If you haven't yet voted in the poll, I'm going to go ahead and give you about 30 more seconds, and then I'll close that down. But leave that 30 seconds open for any more questions.
A couple more on here. Adam Bornhold, what's the difference between our country and others when developing a vaccine, time period, testing, etc.?
That's a good question. It has to do with the United States, the CDC, and how we practice science. And this is where we disagree with Russia and some of the other countries. It's easy enough to come out with something. You put a protein in and get something going or whatever. But for the United States to go through the medical liability, all the other parts of testing to demonstrate the effectiveness of it, it takes a year or two to do that. And that's the difference. The other thing that I would tell you is that with the United States, we've got Mayo and U and several other places working on what that immunization should look like. Should it be an RNA protein? What type of that protein? Is there another protein that should be used? A lot of questions that we're trying to put together in making the vaccine. I'm not sure how Russia did it. I think they picked a protein and they just flew forward. And like I said, instead of going through the mass testing that Oxford and some of the others are going to be doing, which is going to put them out later, Russia is just going ahead and testing it on the population. And frankly, most people say, bring it on. You know, people weren't afraid of it. So that's what's happening. But each country is different. You've got to deal with the rules and regulations. I would say that Canada and the United States and the UK, most of the first world countries are pretty much on the same page.
Thank you.
In terms of the stated meeting, I think most lodge rooms actually spread the brothers out pretty evenly with all the seating and all that. The only concern that we have is the east, and that is where the master and then usually the Leo and then the chaplain sit. You were talking that 6 feet isn't even enough nowadays.
Well, 6 feet is the going number. I'm just telling you that if you're going to social distance, there's a lot of evidence that shows that cough and aerosol goes up to 20 feet. But 6 feet, I think, on the dais is certainly fine. And what may happen is you may have to move them down or move them aside someplace. The other thing, you're right on the lodges. Unfortunately, there aren't enough members to pack the lodge like it should be packed anyway. So social distancing has been too easy.
That is unfortunate, but yeah. So it's acceptable to have the chaplain seating in the regular seats, and same with the Leo. Is that correct?
As long as I would really encourage social distancing, yes. Remember that what's the average age of a Mason? And when you start looking at that, you say, okay, who gets the sickest? And that's that average age of a Mason, basically. It's not the young people. So it's interesting, in the protests, we didn't see a big flux, but everybody was yelling in the same direction. I don't know what all was going on, but for some reason, we haven't really seen a big uptick because of the protests. And it was younger people, but it's not over. And the other thing that's cycling back, the other thing that's interesting in the Southern Hemisphere is that the incidence of influenza is down and other illnesses because of social isolation, social distancing. So as we protect from getting one thing, we're protecting ourselves from other things too. It's going to be an interesting winter. get your flu shot.
This is Mike Peralt from Forest Lake Lodge. I have a quick question on the degree work. And maybe this is centered more towards Rolf. We have 6 people that are waiting for degree work. How do we find out how we can proceed with some of the procedures you were talking about?
What degree are you talking about?
The EA degree.
Okay, what's going to happen, as far as I know from what Brian Bierman, who's the Board of Custodians chair, said, is coming September, they are going to put one on in the metro area. And all of the registration goes through essentially the Grand Lodge. I think there was an edict that came out about it, wasn't there? Or didn't he get that out yet?
It hasn't come out yet.
Okay, I just wanted to know, because I'm going, well, it's all in the edict. It's all straight, and I've read it. So,
I
yeah,
thought I was listening to something.
no, that's my fault. Essentially, the Board of Custodians will be sending a team of 5. The rest of the team will be managed from the area that they're going to. But the 5 people that are coming are the following: the master, the senior deacon, the candidate, and 2 stewards. And the reason that they're sending the 2 stewards is they're going to ask them to do a dialogue of the second section of the lecture.
Okay.
So that's what they're planning on doing. So they're coming down with a team, so you don't need much locally at this point. And then we will eventually find out how this works before we start looking at a 2nd degree or 3rd degree. The only thing a person who is initiated cannot do is he cannot vote, and he can't pay his dues. So,
and to be clear, it will be done in a individual area for now. Metro West, Metro East type thing.
It'll be all over the state, yes.
Eventually farther out, but that's kind of the areas we're talking about.
So do we need to notify somebody how many people we have that are?
Yeah, that'll be in the edict. Everything goes through the Grand Secretary, because we need to say what the building will hold, how many people are coming, how many are coming from lodges. Everybody that comes into that building must be pre-registered or they don't come in.
And how far away are we away from getting that edict?
Well, I thought the edict was already out, so that tells you how close it is.
Okay.
Best answer I can give you.
There was an edict that came out, but it doesn't delve into the details about how all the mechanics are going to work for each of these yet.
Right. It essentially says that you can't have any degree work except as that's put on by the Board of Custodians.
Okay, and could you repeat the 5 positions that it'll be?
Okay.
You said masters?
It's the people that have to touch each other. So then it's the master, the senior deacon, the candidate, and the 2 stewards.
Okay, that makes sense.
Jason, when did that edict come out? I haven't seen anything yet.
It may not have.
Oh,
Last one I got was, I don't remember now.
August 6th.
Yes, that was the last one I got that came out.
Any speculation as to how long this pandemic situation is going to be? Maybe a year, 2 years, 3 years?
I always think about 2 years. Once we get an immunization, then probably another year to get through it. I'm hoping though that by next year things will loosen up. We're putting students back with patients again, which is something we haven't done for several months, and we're trying to move forward. But I'm hoping that with the bubbles and care and screening and everything else, we can start to loosen up a little more. But back to normal life, I'm thinking at least a couple of years.
Well, my job entails travel and to insurance agents' offices, and we're grounded minimum till the end of the year, and looks like first quarter of next year.
I got off an airplane 5 days before everything crashed, and I haven't been on the road basically since. So it's peaceful, and not flying so much. But yeah, it's different. Um, we saw what happened with the Big Ten and what's going on. Um, it's again, the worry is that this is an illness that can be devastating. Maybe we're overreacting, maybe not. We don't know for sure. There's people on both sides of the fence, as you well know. The thing that we were after in the beginning is all of a sudden this thing got out of the bag before we were ready. And it's frustrating in a country such as ours. We were not prepared with personal protective equipment. And that was the disaster that really slammed us down. And the other problem was we weren't sure what was going to happen with ICUs and the need for hospitalization. And certainly being able to convert, the university was able to convert Bethesda, well, it was at Fairview, converted Bethesda into a COVID hospital. That really helped a whole lot. And it made a difference. You know what New York went through and what others are going through. Fortunately, I think there's a lot of people that have had it and get better, but there's that small percentage that don't. And the question is, are we overreacting? Should we just have gone ahead and everybody got it and be done with it? You can say that people are going to die anyway, but we've also lost a lot of people to COVID that wouldn't have died otherwise, and there might have been a whole lot more. So we're trying to keep those numbers down. And the other way you kill pandemics is to try to just starve it out. And I don't think we're going to be able to do that with this one.
Any chance that a suggestion might come out that we do more hydration with distilled products to fight the germs off?
Do hydration with what?
Well, beer, gin, brandy.
Actually,
yeah, alcohol would be disinfectant.
Yeah, the only thing that alcohol is good for is a disinfectant on the skin. It has no other value. And I think you have to think about that a little bit. Alcohol has been used as a social drink and so on here a lot. And it's the things that it does to the body and so on actually are negative as far as where the COVID is. So no, it's not going to happen.
It's interesting because when I went to the dentist, they had me gargle with Listerine, and I thought, well, really, is this of any help?
Don't know. And you didn't swallow it, but I don't know if it's any help or not. I think it makes us all feel better when we do something.
The Listerine had nothing to do with COVID. It was just to reduce your oral bacterial flora.
It's true.
All right. So I don't know if my screen is sharing correctly, but what I've got up right now is the upcoming schedule for the next few webinars.
See it on the screen, Joe.
It's not on there?
No.
Not yet.
If you don't need me, I'll step aside.
All right, so let me go ahead and reshare my screen. I was always worried about that. I had the intro slides up earlier, and for some reason they got kicked down. But here we go. This is the upcoming schedule. We've got next Wednesday, 7 p.m. Grand Master Q&A with Most Worshipful Ethan Seberg, and then we've got a presentation on the 26th for the Golden Ratio, which was an interesting program. If you haven't been able to see it, I highly recommend it. But any other questions before we close out today? This was an excellent presentation. Thank you very much, Most Worshipful Brother Christensen. And then again, if you get a chance, attend the next couple of presentations. They're available to be registered for right now. But any other questions before we close out?
Just one quick statement, Joe. The September schedule will be coming out here shortly. I'll be getting that up on the calendar on the site here soon. I'm just waiting for confirmation on a couple of presenters to make sure we're all good. So
sounds good. All right. Well, thanks everyone for attending. We do appreciate that. If you have any questions, let us know, and we hope you have a great rest of your afternoon, and stay safe.
Thank you, brothers.
Thank you.
Thank you. Quick plug for all the webinars that the Scottish Rite is putting on too. Yeah. All right, everybody have a good evening. Woohoo.
Have a good night.
Yep.